requestion is that the amendment moved by the honourable member for Mayo be disagreed to, and I call the honourable member for Fowler.
Thank you, Deputy Speaker. Like all Australians, I want to see care for our elderly improved where possible and considered deeply. After all, it is something that affects us all. I had the privilege of seconding the amendment made by the member for Mayo, Rebecca Schaker, yesterday in the House. She is a strong advocate for regional Australia, and I trust that her amendment to this bill will ensure senior Australians receive better quality care for what they pay, and it will make it more difficult for vultures that wish to take advantage of our most vulnerable. My contention is not with the government's proposal to cap fees, making aged care more affordable for Australian families, or to improve the availability of information for senior Australians to make informed decisions. However, I do take issue with Schedule 1 of this bill, which proposes to establish a responsibility for providers of residential aged care to ensure that a registered nurse is on-site 24 hours a day, 7 days a week by July 2023. Our nurses have worked tirelessly on the front line through the COVID-19 pandemic, protecting lives and keeping Australians safe. I would especially like to recognise the incredible care given by our nurses in Fowler in supporting a particularly vulnerable elderly population. Some of the people they cared for did not speak English as a first language. Others did not speak English at all, adding to the complexity and stress already being experienced during the pandemic. We will never be able to thank these nurses enough. Despite being immensely overworked during the last few years, the government proposes to have skilled nurses on call 24 hours a day, 7 days a week. I do not harbour concerns over the validity of this proposal. Rather, I'm worried that not enough consideration has been put into how we will support these nurses and how we will expand the number of nurses available for this demanding job. This government needs to be careful to not simply throw money at the situation. Detailed planning needs to be put in place as to how new nurses will be brought into the industry, how they will be trained, and how these skilled workers will be retained. Currently, the proposed staffing standards are pitched well above what can be provided by aged care facilities. The government has stated that nearly 900 new registered nurses will be required to meet the new standards. However, the Aged and Community Care Association has estimated that the sector will instead need 1,440 registered nurses to meet the new staffing requirements. The government's proposal therefore considers the minimum requirements and does not take into account the COVID fatigue of a large portion of our nursing workforce. My constituents, like many around the country, struggle to find and afford care, either for themselves or their parents. Recently, I had a constituent write to me outlining the struggles she had in finding a home care nurse for her father, Anthony Best. Anthony is 90 years old and suffers from macular degeneration. He was assessed for the Commonwealth Home Support Program through the My Aged Care framework, however received no further assistance. His daughter Louise managed to find an at-home nurse, however the standard of care was not what was expected. Due to shortages of quality nurses, the care provider was sometimes unable to provide a nurse at all, and at other times the level of care was not what was required. In Louise's words, the system is broken. While the government proposes to increase the workload of nurses in our communities, they have yet failed to outline how these nurses will be supported so that stories like Anthony's can be avoided. Additionally, regional electorates have already raised concerns around staffing and the lack thereof. My community of Fowler is similar in that sense. We will see a skill shortage as we not only need qualified aged care providers, but they also need to be catering to our non-English speaking residents. There is a cultural and language barrier that needs to be overcome. Knowledge is often disseminated via community groups, friends and family as opposed to formal channels. This was evident during the COVID testing challenges, in which misinformation was raised amongst non-English speaking communities. Our healthcare systems can and should do better for cold communities. Our community of Fowler is a very diverse electorate with a growing population in the South West Corridor and a low expectation of the aged care system. This widening of capacity constraint in the aged care system is being compounded here in Fowler. Many views aged care as only choosing to place their elderly members in aged care facilities without understanding that there are other options to support the elderly and to keep them at home as long as possible. The Cole community have strong family ties, evident through family compositions that are of multiple generations, example, grandparents, parents, children of the same household. They are also generally reluctant to move their elderly away from the home. Services such as shopping trips or GP visits would go a long way to supporting these families without the need to relocate the elderly fully. Matching these offerings would alleviate demand on full-time aged care facilities. I also point to one of my other constituents from St John's Park, Mr Tang. Mr Tang currently lives with his wife and daughter. He came to our office recently inquiring after nursing home places for when he is unwell and immobile. He is worried he will not have the funds to put into securing a place in a nursing home that speaks his language. He says it will cost him $200,000 to move into an aged care home and fears this could cripple his family. Therefore, I support the Home Care Package program, which supports older people with complex care needs at home so they can be closer to their families. Providing alternative aged care options will alleviate pressures on aged care homes and will ensure families can stay together as a unit. But families that have tried to care for their elderly, if possible, at home, do not have enough access to resources or financial support available to our electorate. Fowler constituents face challenges in the understanding of certain aged care services offered and how to access them. Beds available in aged care facilities can do cater to a Cole community are very limited, such as those that cater for culturally dietary requirements and multilingual staff. Recognition of overseas qualifications could also alleviate this pressure on our aged care facilities, who will now have to provide 24/7 care. Refugees and migrants are more than just their harrowing stories of escaping war-torn countries. They are skilled professionals. They are also qualified nurses and doctors. While the government looks to bringing in further 35,000 skilled migrants to our country to tackle the skills shortage, I ask, why not look in our own backyard first? In my electorate of Fowler, we have many migrants and refugees who have skilled qualifications from their homelands. Unfortunately, many do not have the paperwork or evidence to back up their qualifications. Speaking from experience, when you're fleeing persecution, violence or war, you're not thinking about the university degree paperwork or your qualification documents. You are thinking about how to save your life and those of your loved ones. According to the Asylum Seekers Resource Centre, the current recognition of prior learning process is complex and lengthy, which can be difficult for someone who has no knowledge of how our government works. They recommend a new skills assessment system for people without evidence of qualifications against an established benchmark, which should be combined with tailored courses and employment placements to identify their gaps in knowledge. We are wasting the potential of a huge group of people who are ready and willing to work. I commend upskilling our community and offering more government-funded courses in TAFE would be a good alternative to just university courses. I point to countries like Canada, which fast-tracked visas for refugees nurses in the pandemic. They hope to expand foreign credential recognition program, which aims to employ an extra 11,000 overseas-trained healthcare workers a year. Furthermore, those who are seeking asylum could wait up to 5 years for the applications to be processed. During this time, they are kept on punitive bridging visas, which leaves them in purgatory, unable to work or study. I appreciate that the Labor government has committed to reducing this delay in visa processing. However, more needs to be done to action to tackle the crisis at our doorstep. Over 100,000 people are currently seeking asylum. While they wait for their visas to be processed, many cannot access social services, do not have the right to work, or do not have the right to study. There is no access to higher education, and all are excluded from subsidised funding for apprenticeships, training and certifications. If we are to look at reforming TAFE as part of Jobs and Skills Australia, we must also acknowledge that shorter and more practical technical courses could open opportunities to a wider cohort of staff and accelerate the supply to the industry. Aged pensioners who are alone and take care of themselves are reluctant to seek medical treatment due to financial constraints. The recent increase in GPs not bulk billing is accelerating this, which leads to their health deteriorating and adds additional demand to aged care services. With the cost of living pressures, we cannot expect our elderly and vulnerable to break their budget just to get simple healthcare services. We have also received many phone calls from other aged pensioners who have had concerns regarding having to pay out of pocket to see their local GPs. While I commend the government for acting in aged care and continuing the reform by the previous government, this cannot become a tokenistic gesture to stop the cries for help from senior Australians, nurses and the families that just want affordable and quality care for their loved ones. Too long in this House has grant spectacles been the way of government after governments to ease the pressure on them from the Australian people. Now is the time to act. Now is the time to create long-lasting and meaningful change in a sector that has been neglected and forgotten for far too long. I will continue to hold the government to account beyond the implementation of this bill, and I will continue to fight for senior Australians and the frontline workers who wake up every day and put their scrubs to look up after our most vulnerable. When I came to Australia, I was told of the Australian dream. I was told you could achieve the dream if you could contribute to your country and work hard to own a home and raise a family. Part of that dream is that when you get older, you would be cared for. Mr. Deputy Speaker, I will not let Australians who have spent the entirety of their life working to be robbed of that dream. Thank you.